Hey guys, it's Jackie, aka Little J. I just wanted to do this short video. I know it's been some days. I had to get settled in my new townhouse, and now I'm settled in, so I'm doing really good. But that's a whole nother topic. Today we're going to talk about health, um, and how important it is for you to keep your regular follow-ups with your doctors, and if you're on any medications, make sure you take your medication as prescribed, and if you had any questions, to make sure that you let your primary doctor know that you had questions. um, I know I am guilty of not going to the doctor regularly. I really don't like going to the doctors, and I am a nurse, so we all are guilty of this to somewhat or another. African Americans, we are, so I have it twice, are bad about not going to the doctor regularly. So it is important to go to the doctor regularly. You know, if you aren't going to the doctor regularly, and how would you know that you have anything going on with yourself? You won't know because you don't go. Just because you're not sick, physically doesn't mean that there's nothing going on with your body. We all say, "Oh, I know my body," and this and that. Yeah, to a certain extent, you do. I had a SVT, which is a supraventricular tachycardia, where your heart rate is between 200 and 300 beats per minute. Well, 100 to 300 beats per minute. Well, mine was beating 238 beats per minute, and I thought I was 10 seconds away from meeting Jesus, okay? So, but I didn't want to go to the doctor. I didn't know that I even had it. I just know that I had allergies real bad, and I went to the doctor, and he says, "Oh, your allergies are bad. You need to take this medicine for 5 days." And I did what he told me to do. Well, after that, I ended up in the hospital. Um, and then 2 weeks later, I had surgery. So it is important to keep your regular follow-ups, and since that, I do keep my my appointments, and I do go to the doctor regularly because it's scary, especially if you don't know what's going on with your body, and I'm just 32 years old, and I want to live a little bit longer than that, So keep your appointments. If you don't have medical insurance, there are resources out there for you. If you're in the Lawton area, you can hit me up on Aim to Do Better fan page, or email me aimtodobetter@gmail.com, and I'll, get you with the right people that you need to get you to the doctor if you don't have insurance. Women, it is really important to get your mammogram. Especially 40 and over. If you're having any symptoms of breast pain or discharge of anything of that nature, or if you just have breast cancer in your family, then it really is important for you to get your mammogram. Once again, if you don't have insurance, there are resources out there. You can email me, or send me a message on Facebook. Okay. There are a lot of diabetes and high cholesterol and high blood pressure. Those three are really high. Fast foods, you want to stay away from the fat foods and try to do a heart healthy diet and stay away from the sodas. I'm guilty of that. I love me a Diet Dr. Pepper, but I've been doing good. And make sure you exercise. Get up and get that heart racing, and get the sweating and everything. It makes you feel good. Get your nap whenever you can. Makes you look youthful. And I know we all want to look youthful, especially us women, right? Okay. So make sure that you all are, doing what you're supposed to, and getting those normal follow-ups, 6 months to a year, whatever your doctor says. Don't take years off. Things change in years, and we all have, stopped going to the doctor, and then next thing you know, you have a foot, and then you go to the doctor and they say, "Oh, well, you have diabetes," or whatever, and then you have half of a foot. Well, if you kept your normal follow-ups, that probably could have been prevented, okay? So the doctors, once again, they're not there to hurt you, or neither are the nurses. They just want to help you, okay? So you all make sure you're taking good care of yourselves, especially if you have children. I'm quite sure you want to see your children grow up and grandchildren grow up. So take good care of yourselves, okay? So if you have any questions, like I said, if you're in the Lawton area, um, and you need a doctor, or you don't have any medical insurance, you can hit me up, aim to do better gmail.com. Hit me on Facebook, aim to do better, or my personal Facebook page, uh, Jacqueline Blunt, BLOUNT, and I will get you to where you need to be. Okay. If you're not in the Lawton area, I will do my best to get you the resources that you need to get you where you need to be. Okay. I love you guys. It was good seeing you. So I will see you guys tomorrow. Bye.